Welcome to United Healthcare's new series, An Exchange on Affordable Healthcare Access and Issues on Fox 5. Today, we have with us Dr. Arthusa Kirk. She's the National Senior Medical Director at United Healthcare. And we have Dr. Sonia Bruton. She's the CEO of CCI Health and Wellness. Ladies, thank you both for joining us today.
Thank you so much for having us.
Yes. Okay, so let's just jump right in. We're hearing a lot about health insurance exchanges and health and telehealth throughout the past year with the pandemic and all. So what exactly are they and how do they go together, ladies? Let's start with you, Dr. Kirk.
Sure. Thank you so much for the question. Exchanges are also called health insurance marketplace, and they really help individuals, families, and small businesses enroll in and shop for health insurance. We know access to care is a very important issue, and so exchanges are part of that. Many people are eligible for subsidies. There are two types that help reduce the cost of overall coverage, which we know is also an important issue for many families and individuals. And the two types are the premium tax credit, as well as the cost sharing subsidy. And the way that they help reduce costs overall is the premium tax credit can reduce your monthly cost, whereas the cost sharing subsidy, or often called the cost sharing reductions, can help reduce your overall cost for some of those doctor's visits and procedures, et cetera. We know telehealth was really important during the pandemic, and telehealth care is offered as part of healthcare exchange programs like our friends at CCI. And so Dr. Bruton's going to talk a little bit about that.
Thanks, Dr. Kirk. At CCI, we found telehealth, which are also known as virtual visits, to be a wonderful way to supplement medical care and a way to increase access. It's really important that everybody understand that it's a tool for support. It doesn't replace that traditional model of care. Lots of predictions about whether that will go away or not, but I'm here to tell you not yet and not in the foreseeable future. We've actually found that it's best used for some specific situations and conditions. The first is anything that relies on the patient report. What happens in that virtual visit, pretty much the same thing that would have been happening in the room. The patient is telling you what's going on with their health and with their thinking and with their lives as they interact with their bodies and the conversations and activities that they have each day. Second, it's really good for in-depth education. Maybe somebody's been in the hospital and there's some follow-up care, or maybe they don't completely understand the condition that they're trying to manage. That virtual visit really is a great platform for having those more detailed conversations. It also can prevent lapse in care, meaning the person wouldn't have been able to get in, and so it would have been, the visit would have been canceled otherwise. That virtual visit allows the exchange of what's going on and care to be delivered. And finally, it helps to really avoid trips to the ER. There are times when a patient is not sure, should I go in for an emergency visit? Can this wait? We can really convert that to a quick telehealth or virtual visit and answer that question, and sometimes perform care that completely handles the needs and completes the visit.
Saving money, saving time, saving anxiety. So that's what telehealth has seemed to really help quell a lot of our issues. Can you talk to us about how telehealth became so important during COVID-19 and how it can continue to be used? Let's go to Dr. Kirk.
Sure. During the public health emergency, healthcare practices like CCI really had to pivot to help create access for patients and families, really as part of some of the infection control protocols to ensure that there was a proper physical and social distancing. Ideally, it's best to see doctors in person, but there are a lot of use cases, as Dr. Bruton went through, that really elucidate why telehealth and virtual visits are such an important component. Visits can be done through your smartphone, your computer or tablet, and through secure platforms to help people maintain privacy. The main thing that's really important to understand about telehealth is that it's access to care when you need it, which is really one of the key components of really good healthcare. And it does reduce the emergency room and urgent care visits when you don't need them, which can help reduce the cost of care for people who are seeking care as well.
Dr. Bruton.
Yeah, I'd love to add that we're finding that, especially when it comes to those behavioral health visits, they really fit that criteria I just gave you. It's a lot of self-report. It's a lot of me telling you something you need to do differently in your life and you doing it. So that treatment plan adherence, those things align perfectly with the behavioral health visit. And we've seen it really successful for that kind of care. I do have to caution, though, that we're finding that there is still one barrier, and that's privacy. What you know is that when you're at home, you're often not alone. And we don't have commercial grade walls in our house that allows that what is said in one room may not be heard in another. And so it's really important to remember that in some instances, privacy is compromised because there are other people around. And sometimes it's compromised because of the way that household works and the dominance that sometimes can happen for certain cultures more than others around males and their belief that they really control everything that happens and goes on in that household and everybody who lives within it.
It offers an opportunity for you to figure out if you can self-segregate yourself in your home to just make your own privacy. Otherwise, it could be confusing. What types of services, when we talk about exchanges, what type of services can be covered by telehealth when it comes to the exchanges plan?
Yep. So telehealth may be covered by your insurance. It's important to check with your insurance to ensure what type of telehealth coverage is covered. Some examples of the types of visits that you could have through a virtual visit, Dr. Bruton went through, but really the common ones that would be sort of routine checkups for things like allergies. Common complaints for rashes can often be seen through a smartphone, tablet, a camera in a really useful way. Chronic disease checkup, especially for medication adherence management, and the types of things that really require some of that just in-depth conversation around nutrition and behavioral health approaches to disease management. Specialty care can also have some telehealth that's covered as well, which is important for people as they're trying to access and deal with chronic disease management in general.
And I was curious about possible equipment that you use to maybe get your privacy a little bit more secure. Do you guys have any suggestions at all?
One of the things that we've done to help open up and increase the access for care is we've sent home virtual or home-based monitoring devices, and so that patients can track their own conditions. Let's say high blood pressure, we've sent the blood pressure cuffs and they can keep up with their readings, and they can also give us that data when we're having the visit or the conversation. There are also things that have been sent around diabetes and getting those numbers and sending those in. What we've done really is recognize that whether somebody comes in for service or whether somebody seeks to have that service administered with them at home, we've taken away the barriers around information exchange that needs to happen to make it a quality visit and making sure that we know what we're treating and what needs to happen next. The only areas that we found so far that we haven't quite been able to bridge that gap, blood work, we need people to come in so that we can capture that. Also urine samples. There are lots of things that can go back and forth through the mail. Those two things, not quite yet.
Right. So who's benefiting from telehealth? Dr. Kirk.
Well, tremendous amounts of patients and members for insurance companies, but the patients themselves, and certainly clinics and providers who now have a way to be able to help serve more patients. We know that the numbers of folks that really access telehealth services and virtual visits during the public health emergency rose in a tremendous number. We do find that more adults are generally using telehealth, those that have technology-enabled services. We do need to acknowledge that there's a digital divide, and that's one of the things that I think in the go forward we're going to be looking at to help communities with less access and communities of color who may not have those resources, ensure that they have the access as well.
Dr. Bruton, what about senior citizens? How are they dealing with telehealth? Good, bad?
We found that, senior citizens are surprising everyone and jumping on and able to access the services, maybe at slightly smaller numbers, but at numbers that are still respectable. In the beginning, sometimes seniors want that first visit to just be on the phone. And once they've been able to establish that rapport and get comfortable with the steps, someone can like talk them through. Maybe they'll have their computer nearby or have a tablet, and the person on the other end of the phone line can really walk them through step by step what they would need to do to add the visual component. That taking those additional steps, giving that additional time, has been all that's needed to bring them right on board.
And Emily in the Facebook chat wanted to know, like, when do you make that decision? Do you go in? Do you do telehealth? Like, how do you make that difference?
One of the things that we can say to Emily and others is that is a conversation you can actually have with the practice. So you can call and there will be a care team member who will actually help you figure that out, to figure out if, yep, what you want done today, we can actually do with you staying at home, or no, this one you really need to come in for. Some of the rules of thumb though, if you're needing a refill, if you've got a condition that's already been diagnosed, a treatment plan that's already been put in place, and all you need is more of what you've been getting, that can probably be done virtually. You don't have to come all the way in for that. If it's something that isn't quite working for you, we need to make some tweaks to it, that might be a good time to actually come in and have a deeper look and a deeper conversation happen.
Okay. Well, for Emily, anyone else who has additional questions, wants to find out more information, how can they get in contact with you all and learn more?
Well, for the exchange, it's uhcexchange.com/Maryland, or the Maryland Health Benefit Exchange, uhcexchange.com/Maryland.
Okay, Dr. Bruton.
And for CCI, you can get us in any way that you need. You can follow us on Twitter, Instagram, and Facebook at CCI Cares, or you can go to our website, cciweb.org, and there'll be telephone numbers that you can use, or you can just send in the private messages and we'll get right back to you.
Well, that's all the time we have for today's segment. Ladies, thank you very much for joining us today for United Healthcare Series, an exchange of affordable healthcare access and issues on Fox 5. For Dr. Kirk and Dr. Bruton, thank you all for joining us today.
Thank you.
Thank you.
Hello, I'm Nikki Mayo, and welcome to United Healthcare Series, an exchange on affordable healthcare access and issues on Fox 5. Today's discussion with Greater Baden Medical Services focuses on exchanges, the American Rescue Plan, and federally qualified health centers, otherwise known as FQHCs. Joining us today, we have Caitlin Wee and United Healthcare, and Sonia Bacchus. She's the CEO of Greater Baden Medical Services. Ladies, thank you both for joining us today.
Thank you.
All right, so let's just jump on in. What are health insurance exchanges and subsidies? Caitlin.
Good morning. So we are happy to be here today to talk about health insurance and health insurance exchanges. So specifically, states and the federal government run health insurance exchanges to provide health insurance for people who need to buy health insurance and aren't getting the insurance from their jobs. And so, we encourage, like during the pandemic, we've seen that a lot of people feel that it's, even more important than ever, right, to make sure that they have health insurance. And so if you don't have coverage from your job, if you go to a health insurance exchange, you may qualify, right, for financial help to help pay for your premiums and for other out-of-pocket costs that go with your health insurance. So if you're interested in health insurance, today we really want to just encourage everybody to look at their options and to see if you qualify, right, for subsidies to help you pay, right, for the cost of your coverage.
And Sonia.
How FQHCs are critical to the exchanges is that as federally qualified health centers, we exist to provide primary and preventive care to everyone. That's regardless of ability to pay. So there are folks who might not be confident about seeking health care. If they're accessing an exchange health plan, such as the one that Kathleen Wee leads with United Healthcare, they have an opportunity to use a federally qualified health center for primary care. And the unique thing is that we also provide wraparound services such as dental care, behavioral health services, and HIV and AIDS prevention and care as well. We also help folks to access specialty care. Again, that's going to be covered by their exchange plans. So we get to be kind of a one-stop shop. And so when folks are using the exchange or other insurances, they can rest assured that they can get a number of services within the FQHC.
And who's eligible to receive exchanges and care from an FQHC?
Actually, anyone is able to receive care from an FQHC and through the exchange. We really exist to serve uninsured, underinsured, as well as those who have Medicaid. We serve commercial plans as well, but our primary focus is really the vulnerable populations and folks who, many of the individuals and families who choose the exchanges, they are in that kind of in-between range in terms of from a financial standpoint, and we are absolutely the best place for them to get care.
Okay, and correcting myself, Kathleen, right? Yes. Okay. Help me out. What type of benefits are offered with the exchanges?
So in the state of Maryland, so people who are interested in the exchange in Maryland can go to the MarylandHealthConnection.com, and in the district, it's DCHealthLink.com. And if you go to those websites, you'll see that the insurance exchange plans offer, full coverage for, hospital, physician, prescription drug care, et cetera. I think that in particular, right, for exchange products, we at United Healthcare have really focused on, free preventive care, right, so that people have the access that they need, right, to preventive care services. And, we really rely on partners like FQHCs, right, and like Greater Baden to really help our members get access to those types of services.
Okay, and we really rely on competent services and sources like you. So where can people go for more information?
Sure. So to reach us at United Healthcare specifically, go to uhcexchange.com/MD for Maryland. But I mentioned the websites to go directly to the state health benefit exchanges in this region. So the Maryland Health Connection for the state of Maryland, and DCHealthLink.com for the district.
Okay, and Sonia.
For Greater Baden, our website is www.gbms.org, and you can also directly contact us through our Patient Access Center at 301-888-2233.
Thank you both for helping us out today. That's all the time we have for today's segment for this United Healthcare series and exchange on affordable healthcare access and issues on Fox 5. On behalf of the ladies here, thank you for joining us.
Thank you.
Hello, I'm Nikki Mayo, and welcome to United Healthcare series and exchange on affordable healthcare access and issues on Fox 5. Today's discussion with Prince George's County Health focuses on exchange basics. Joining us, we have Kathleen Wee with United Healthcare, and we have Jessica Fuentes. She's a certified navigator of Prince George's County Health Connect. Ladies, thank you both for being here today. Let's jump right in. With Kathleen, what are health insurance exchanges and subsidies?
For people who are looking for health insurance exchanges are a resource for you to be able to find an affordable health plan that will work for you. And so in specific for exchange plans, you may qualify for financial help to help with the costs of premiums and other out-of-pocket costs that go with health insurance. And so going to your health insurance exchange, you'll have the opportunity to figure out if you're eligible for an exchange plan and eligible for that financial help, or you may potentially be eligible for other government programs like the Medicaid program or the Medicare program. And so the folks at the exchange can help you find the right options for you. And in the state of Maryland, you can find the exchange at the MarylandHealthConnection.gov. And Jessica here is a certified navigator and will be telling you more during this segment on how to find a good health plan.
Gotcha. And who's eligible, Kathleen?
If you don't have health insurance, going to the health insurance exchange will help you figure out what programs you would be eligible for. And depending on your income and your family size, will help determine what coverage is really the best fit for you.
Jessica, can you talk about how navigators help people figure out their eligibility? And just honestly, it can be very confusing. How do you guys do this?
Yes, so I am a certified navigator for Prince George's County Health Connect, as you all mentioned, and we are actually one of 6 consumer assistance organizations, and we are scattered across the state of Maryland. Our sole purpose is to provide that compassionate, one-on-one, individualized education and counseling to Marylanders, although we are in Prince George's County, but as I said, we have other consumer assistance organizations in other jurisdictions. So we just want to bridge that gap and provide education to individuals that call us in. It's completely free and personalized.
It's very personable, of course, and you're helping people figure it out. Okay, what type of benefits can I have? So what type of benefits are offered with these exchanges, Jessica?
Yes. So as a navigator, we help individuals fill out the application for health insurance through the state of Maryland, through the Maryland Health Connection. And we help them figure out what they're eligible for. It's one application, so it makes things a little quicker. And we determine eligibility for financial assistance. And financial assistance is given in 3 different ways. So the first way is with Medicaid or the MCHIP program, which is Medicaid for kids. And the other financial aid that we provide is through a tax subsidy, and that is the advanced premium tax credits. I don't want to scare anyone away with those terms, but to make it simple, it is a discount that is applied to your monthly premiums. Then we have cost sharing reductions, which help pay for the out-of-pocket expenses for individuals. So it helps cover co-pays, co-insurances, and deductibles.
And Kathleen, can you talk about how United Healthcare is always trying to connect people with the navigator so they can understand the process?
Yeah, as you heard from Jessica, it can be a confusing process. And so, we really encourage people to tap into navigators and if you come to the Maryland Health Benefit Exchange at marylandhealthconnection.gov, that website can help you find terrific people like Jessica who can help you with your health insurance decisions.
Okay, people always want to know more. So if I wanted more information, how can I get in contact with you all? I guess start with Kathleen.
Sure. So in addition to just going straight to the marylandhealthconnection.gov website, you can find us here specifically at United Healthcare at uhcexchange.com/MD for Maryland, and learn about United Healthcare's exchange offerings at our website.
Okay, and Jessica, for Prince George's County Health Connect.
Yes, so aside from the state's official marketplace website, marylandhealthconnection.gov, Prince George's County Health Connect has their own website for local information, and that is pgchealthconnect.org. And currently, navigators are providing touchless remote assistance over our call center. And I can provide that number now. So it's 301-927-4500. And we provide assistance Monday through Friday from 9 a.m. to 4 p.m.
Okay, that's all the time we have for today's segment with this United Healthcare series, an exchange on affordable healthcare access and issues on Fox 5. Thank you, ladies, for being here today. And for all you all watching, if you have any questions, connect with them. Thank you for joining us.
Thank you.
Thank you.